My priorities are simple: COVID, recovery, reform. COVID, getting us and keeping us out of this pandemic. Recovery, tackling the huge backlog of appointments that it has caused. And reform of our health and social care systems for the long term. Today, I'm going to look forward. We can all be here at this conference and talk about the future because of the success of our vaccine program. An amazing example of what public-private collaboration can do. Of course, we cannot afford a single dose of complacency. This virus has shown itself to be unpredictable, but so far, our vaccine wall of defense has held firm, and we will keep strengthening it, brick by brick, jab by jab, with one of the only national booster programs in the world. We took the difficult decision before the summer to put our faith in that vaccine wall. Before that was possible, as a country, we sacrificed our freedoms and our way of life to protect our elderly and vulnerable. The pandemic has been described by some as a great leveler. That's just not true. Health disparities in our society, whether they are regional, racial, or socio-economic, they have deepened under COVID. That's why one of my first visits as Health Secretary was to Blackpool. I remember one of the nurses there. She told me that, you can trace back the entrenched health problems in Blackpool going back over a century. Let me ask you this. Do you know what the healthy life expectancy gap is between Blackpool and Richmond upon Thames? It's almost 20 years. It's time to level up on health. The state was needed in this pandemic more than any time in peacetime. But government shouldn't own all risks and responsibilities in life. We as citizens have to take some responsibility for our health too. We should always go first to the state. What kind of society would that be? Health and social care. It begins at home. It should be family first, then community, then the state. If you do need support, we're lucky we live in a compassionate society in a developed country that can afford to help you. There are few higher callings for anyone than to care for another person.